Stop for a moment and raise your palm in front of you. Do not just glance at it. Examine it carefully and with full attention. In the next few minutes, you will learn something that cardiologists observe every day, but almost never explain to their own patients. Your nail plates are recording information about your heart function and the condition of every blood vessel in your body right now. They have been doing this your entire life, but nobody ever taught you how to decode the signals sitting right there on the surface. My name is Dr. Artem Valansky, and I have spent over 20 years in preventive cardiology working with adults across all age groups. Every week, patients come to me after a heart attack or stroke, and during examination, I find warning signs that were visible long before. Those signs had been sitting on their fingertips for months, sometimes years, but neither the person nor their family ever noticed them. Today, we will close that gap once and for all, because knowing a few visual markers on your nails could genuinely save your own life. Watch until the very end, because the final sign on our list causes genuine shock in most people when they first learn what it means. Type your age in the comments right now and tell me whether anyone in your family has ever experienced a heart attack or a stroke event. Your answer will reveal how urgently you need everything we are about to discuss over the next 15 minutes of this particular video. If this kind of content is helpful to you, please hit the like button right now because it truly helps bring this information to more people. Why your nails know more about your heart than you do. To understand why nails carry so much diagnostic data, you need to grasp one straightforward biological mechanism inside your own body. Every nail grows from a special zone called the nail matrix, which is located directly beneath the base of each individual nail plate structure. The cells of that matrix are in continuous direct contact with your bloodstream and receive nutrition from the tiniest vessels in your body. Those vessels are the nail bed capillaries, and they are so incredibly thin that they react first to any disturbance in blood circulation. Research from Harvard Medical School has confirmed that finger microvessels reflect systemic cardiovascular changes earlier than other sites. Imagine that on the tip of every finger there is a miniature sensor recording the condition of your vascular system around the clock today. That sensor does not beep or flash red warning lights, but it leaves visible marks directly on the surface of your nail for you to read. The problem is that a standard 15-minute appointment with your general practitioner physically cannot include a nail exam for everyone. The doctor checks blood pressure and listens to your heart and reviews your labs, and there is simply no time left for a detailed finger check. The result is a paradox where medical science has long known about these markers, but the patient at home remains completely unaware of them. That exact gap between published scientific knowledge and everyday personal practice is what I want to bridge for you today in this talk. All you will need is good daylight, a couple of free minutes, and attention to the specific details that we are going to break down together. Why this becomes critically important. After 60. In a younger body, the heart has a powerful reserve capacity and can compensate for minor malfunctions completely, invisibly, for many years. At 30, a hidden dysfunction can quietly exist for years, and the person will not feel absolutely any external symptoms at all in daily life. But after 60, the compensatory reserves of the cardiovascular system become significantly narrower, and that is a well-documented medical fact. The Mayo Clinic has published data showing that with age, microvascular disturbances manifest visually much earlier than subjective complaints do. This means that after 60, your nails begin showing problems faster than any feelings of chest pain, shortness of breath, or unusual fatigue. The body can no longer hide malfunctions behind a thick wall of reserves, and the signals start surfacing right on the outermost tissues. According to the European Society of Cardiology, every third heart attack in people over 65 occurs without any typical chest pain at all. The person walks through it blaming the weakness on tiredness, or age, or bad weather, and loses critical time that could have gone to treatment. That is precisely why visual markers on nails gain special value, because they do not depend on how the patient subjectively feels that day. They are simply present or absent, and all you need is to know where to look and what exactly counts as a deviation from the healthy norm. None of these signs require laboratory tests or expensive equipment or any kind of specialized medical training to identify them on yourself. Let us move to the first specific sign, and you will see how simple early vascular self-screening can actually be with the right knowledge. First sign, Terry's nails. This term rarely comes up outside medical circles, but after today you will look at every pair of hands around you in an entirely new way. Terry's nails look like this. The entire plate turns matte white, or extremely pale, resembling the texture of frosted glass across its surface. At the very tip of the nail, a narrow strip of pink or reddish color remains, usually just a couple of millimeters wide and clearly visible. That contrasting strip at the tip is exactly what distinguishes Terry's nails from ordinary paleness caused by cold temperatures or mild anemia. A study published in The Lancet found that Terry's nails are associated with coronary artery disease with an odds ratio greater than 6. That is not a minor statistical footnote, but a serious clinical marker that deserves immediate attention from a qualified cardiologist today. All conditions linked to this sign share one common feature. They develop slowly and silently over many years before anything dramatic happens. One of my patients, let us call him Gerald, came in at 71 with no major complaints, just feeling slightly more tired than he used to. I noticed the characteristic paleness of his plates, with the reddish band at the tips, and immediately ordered an echocardiogram for him. The result revealed early-stage heart failure that had been developing for nearly 2 years without producing any noticeable painful symptoms. Today, Gerald feels well because treatment started in time thanks to one attentive look at his nails during a routine clinical examination visit. Hold your hand up to the light right now and check whether your nails show that matte paleness with a contrasting strip along the edge. Second sign, Lindsay's nails. The second marker has such a distinctive appearance that once you hear the description, you will recognize it instantly on any hands around you. Lindsay's nails are also called half and half nails because the plate is clearly divided into two contrasting color zones from base to tip. The half closer to the cuticle stays white, or very pale, while the half closer to the tip takes on a distinctly brownish red color tone overall. The boundary between the two zones usually runs sharply and clearly without a gradual transition, which makes this sign easy to spot visually. Clinical research associates Lindsay's nails with chronic heart failure, liver cirrhosis, and sustained impairment of peripheral blood flow over time. They tend to appear when the body has been under prolonged circulatory stress and the peripheral tissues are chronically deprived of blood supply. I group Terry's nails and Lindsay's nails together because both signs reflect compromised blood delivery to the nail bed capillary network area. When circulation to the extremities suffers over a sustained period, the bed loses its healthy pink color and the plate pattern begins to change. Both signs are visible in ordinary daylight without any special equipment, and you do not need a magnifying glass or a medical examination lamp. If you bring your hand to a window right now and carefully examine each finger, the entire check will take you no more than 30 seconds. Do it right now while the description is fresh in your mind, and then move to the next section where we will cover an even more alarming sign. By the way, if you have already spotted something suspicious, do not panic yet, but wait for the finale, where I will give a clear action plan. Third sign, Muehrcke's lines. Now let us talk about a sign that most people notice on their nails at some point, but simply dismiss as aging or a vitamin deficiency issue. Muehrcke's lines are multiple horizontal white bands that run parallel to the lunula, meaning they stretch straight across the entire nail plate. The key feature of these lines is that they are completely smooth to the touch. You can see them with your eyes, but not feel them at all. This specific detail is what separates Muehrcke's lines from other types of transverse ridges that you might discover during a tactile examination. A study published in the American Journal of Medicine linked Muehrcke's lines to heart failure with a statistically significant risk factor of 6. Behind the appearance of these bands lies a drop in blood albumin levels, which points to prolonged nutritional and cardiovascular stress overall. When the heart fails to circulate blood efficiently, every tissue suffers, and the nail matrix records this ongoing deficit as white horizontal bands. My patient Margaret, 68 years old, came for a routine visit and mentioned strange bands on her nails almost as a casual aside remark. She believed they were just age-related changes, and even felt slightly embarrassed to raise such a trivial detail during a serious appointment. I recognized classic Muehrcke's lines on several fingers and immediately ordered a comprehensive cardiovascular workup for further investigation today. The results confirmed early heart failure, which at that stage responded well to medication and could be managed without any surgical intervention. Those bands had been appearing for months, and throughout that time, Margaret's body had literally been asking for help through her nail plates. Fourth sign, Beau's lines. This sign tells a completely different story because it is connected not to a chronic ongoing process, but to one specific physiological event. Beau's lines are noticeable transverse grooves or depressions on the nail plate that you can both see with your eyes and feel with your finger. They appear because during a severe physiological shock, the nail matrix temporarily stops producing new cells and pauses its growth entirely. When growth resumes after the crisis, a clear groove remains on the plate like a ring mark on a tree trunk after an especially dry summer. The cause can be a heart attack, a severe infection, major surgery, or any other powerful blow that temporarily overwhelms the entire body systems. The most important clinical value of Beau's lines is their ability to reveal an event that the patient themselves may not even be aware of. According to the American Heart Association, up to 45% of heart attacks in elderly patients occur without any obvious chest pain. The person assumes they had a bad flu or severe food poisoning, while in reality, their heart muscles sustained significant damage during that illness. My patient Harold came to see me for an entirely unrelated matter, but I noticed a distinct groove running across every single one of his nails. After some discussion, he recalled being seriously ill 4 months earlier with extreme weakness that he had simply attributed to a viral infection. Testing revealed evidence of a prior silent heart attack, and the Beau's lines told the story that his symptoms had completely kept hidden away. Now run your finger across each nail and check whether there are any grooves you previously dismissed as mere scratches or simple roughness. Fifth sign, splinter hemorrhages. We now move to a sign that hides not on the surface of the nail, but beneath it, and it looks quite unusual to anyone seeing it the first time. Splinter hemorrhages are thin, dark lines running vertically under the nail plate resembling tiny splinters or small wood chips trapped beneath it. In reality, these are microscopic collections of blood trapped inside the nail bed capillaries due to damage in the smallest vessels underneath. A single such line after bumping or injuring your finger is perfectly normal, and there is absolutely no reason to worry about an isolated case. But when unexplained dark streaks appear simultaneously on several nails without any trauma, that is an entirely different clinical picture to consider. In medical textbooks, multiple splinter hemorrhages are classically associated with infective endocarditis, which is an infection of the heart lining. This dangerous infection of the heart chambers and valves develops when bacteria enter the bloodstream and settle onto damaged cardiac tissue inside. The infection produces microscopic clots that break off and travel through the bloodstream, eventually reaching the tiny capillaries beneath your nails. Research from Johns Hopkins University confirms that this finding warrants urgent examination of the heart valves without any unnecessary delay at all. My patient Fiona noticed dark streaks under her nails and mentioned them almost by accident, thinking it was just a minor cosmetic issue overall. Testing revealed a heart valve infection that was caught and treated successfully precisely because it was discovered at an early treatable stage. Fiona later admitted she nearly stayed silent about those streaks, and that silence could have cost her life without any exaggeration whatsoever. Sixth sign, lunula. Color changes. If what you are hearing right now is useful, please hit the like button this very second because it takes one moment and helps many others. The small white crescent at the base of your nail is called the lunula, and most people think of it as nothing more than a decorative feature. In reality, The lunula is the visible portion of the nail matrix, which is the active zone where brand new nail cells form around the clock non-stop. The color of this crescent is one of the most underestimated diagnostic signals on the entire human body, according to practicing cardiologists today. A reddish lunula, according to cardiology research, is significantly associated with valvular heart disease and with congestive heart failure overall. A bluish or purplish tint to the lunula suggests problems with oxygen delivery similar to the cyanosis seen in advanced cardiovascular disease cases. A lunula that is faded to near invisibility often indicates anemia, which is directly linked to increased cardiovascular strain on the heart muscle. An anemic heart is forced to work considerably harder to compensate for the reduced capacity of the blood to carry oxygen to all body tissues. My patient Dorothy, 74 years old, came in after her daughter, who was a nurse, noticed the crescents had almost entirely disappeared. Dorothy herself had not noticed the change because it had happened so gradually that her eyes adjusted to the new appearance every single day. Testing revealed significant anemia and early cardiovascular strain, and both conditions were corrected before any serious complications had time to develop. 3 different lunula colors point to 3 different problems, and every single one of them deserves a medical visit without delay or excuses. Capillary refill test. Check yourself in 10 seconds. Right now, I'm going to teach you a simple test you can perform this very moment using nothing but your own 2 hands in a few seconds. This test is called capillary refill, and it directly measures how quickly blood flow recovers in the smallest vessels after brief applied pressure. Hold your hand at heart level and use the thumb of your other hand to press firmly on any fingernail for approximately 2 full seconds now. You will see the nail bed turn pale or white because the pressure pushes blood out of the capillaries that sit directly beneath the nail plate. Now release the pressure and start counting seconds in your head. In a healthy person with normal circulation, the pink color returns within 2. If the color takes 3 seconds or longer to return, and you get the same slow result on 3 or 4 fingers, that is a meaningful warning. Research has linked slow capillary refill in older adults to reduced cardiac output and to undiagnosed atrial fibrillation hiding in the background. Atrial fibrillation is one of the most common and dangerous causes of stroke in adults over 60, according to current global medical statistics today. My patient Victor performed this test at home one evening and counted nearly 5 seconds before the color returned to his index fingernail. He checked the remaining fingers on both hands and got the same slow result every single time, so he called my office the following morning. A full workup revealed atrial fibrillation that Victor had no idea about, and timely treatment very likely prevented a major stroke that year. Perform this test right now in a warm room with warm hands so that cold temperature does not distort your result, and remember your number. How this knowledge has saved real lives. Let us pause for a moment and reflect on what unites every patient story you have heard during the course of this entire conversation. Gerald came in simply feeling tired and left with a diagnosis of early heart failure, caught well before his first serious cardiac episode ever hit. Margaret felt embarrassed mentioning white bands on her nails. Yet those bands turned out to be the only visible signal of approaching disaster. Harold had no idea he suffered a real heart attack 4 months earlier, and only the grooves across his nails finally revealed the hidden truth. Fiona almost stayed silent about dark streaks, and that silence could have allowed a valve infection to destroy her heart without any warning sign. Dorothy never noticed her crescents disappearing because the changes were so gradual that her brain accepted the new normal every single day. Victor simply counted seconds after pressing his nail, and thanks to a 5-second delay discovered hidden atrial fibrillation lurking inside his heart. Every one of these people could have missed their signal, and statistics show that the vast majority of people do exactly that every single day. According to the World Health Organization, cardiovascular diseases remain the #1 cause of death on the entire planet year after year globally. A significant portion of those deaths involves cases where early signs were available and accessible, but simply went unnoticed by the patient at home. The difference between a good outcome and a tragedy often comes down not to expensive drugs, but to one attentive look taken at the right time. You have just received the knowledge that makes that attentive look possible, and now it is entirely up to you whether you will use it or not. A 2-minute nail inspection, step by step. Right now, I will give you a concrete action plan that you can carry out today, not next week, and certainly not at some distant future appointment. Go to a window with good natural daylight and place both hands in front of you, palms down, so that you can clearly see all 10 fingernails. Examine each nail plate one at a time and assess the overall color. Check for matte paleness with a narrow pink strip along the very tip edge. Check whether any plate is divided into 2 distinct color zones, pale near the base and brownish red closer to the free edge of the nail plate. Look for horizontal white lines running across the nail and run your finger over them. If you see them but cannot feel them, then note that fact. Now slide your finger across each plate and feel for grooves or depressions that might indicate a past physiological shock event or severe illness. Look through the plate at the bed beneath it and search for thin, dark vertical lines resembling tiny splinters embedded under the nail surface area. Pay attention to the lunula at the base of each nail and note its color and size and whether it is even visible at all on every single finger. Then perform the capillary refill test on at least 3 different fingers and honestly time how many seconds it takes for pink color to return. Write down everything you find because in 6 months, you will not remember the details, and changes on nails happen slowly and almost invisibly. Even better, take a photograph of both hands in daylight so that in 6 months, you have an objective reference point for an honest comparison. Human memory is unreliable for tracking slow, gradual changes, but a photograph captures reality without distortion and without any self-deception. When to call your doctor and when to simply observe. One isolated sign on a single finger is a reason to observe, document, and calmly mention it at your next routine scheduled medical appointment. But if you have found 2 or more signs simultaneously across several fingers, do not wait for your annual checkup. Call your doctor this week. Describe to your doctor specifically what you saw, which sign, on which fingers, how long you have noticed it, and any accompanying complaints too. The more precise your description is, the faster the doctor will understand which tests to order, and the less time will be lost on diagnostics. Research from Stanford University showed that informed patients receive their diagnosis on average 4 weeks earlier than uninformed patients do overall. That is not trivial. With cardiovascular diseases, 4 weeks earlier can literally mean the difference between simple medication and the intensive care unit. Subscribe to this channel right now if you want to regularly receive practical breakdowns like this one that you can apply at home starting today. But I need you to remember one critically important thing. Nothing said here is a substitute for professional medical evaluation by a qualified doctor. Your task is not to diagnose yourself, but to notice changes, document them with notes or photos, and seek medical attention at the right time. A complete clinical picture includes your medical history, medications, lab work, and physical exam, and only all of it together yields a diagnosis. Your role is to be an attentive observer and an active participant in your own health rather than a passive person waiting for bad news to arrive. Most people never take this simple step, and yet it is precisely this step that most often turns out to be the one that changes everything ahead. Your nails have been speaking to you your entire life. Your nails have been sitting on the tips of your fingers every single day since the moment you were born, never once stopping their recording. They have been tracking how your blood moves, how your heart performs, and what is happening inside the smallest vessels of your entire body. Every pale plate and every band and every groove and every changed crescent is a message that your body wrote specifically for you to read someday. The only thing that was missing all these years was someone to explain how to read what had been continuously recorded right there on your hands. Now you have that knowledge, and it did not cost you a single dollar or a clinic visit or a single needle prick or any painful laboratory test. All you need is daylight, 2 minutes of focused attention, and the resolve not to ignore whatever you discover on your own hands here today. Use what you learned today, not tomorrow and not next week, but today, while the information is fresh and your motivation has not yet faded. Send this video to someone you love, because the next person who watches it might discover a warning sign on their own hands this very evening. Perhaps tonight someone close to you will look at their hands, see one of these signs, and make a phone call that ultimately saves their own life. That is not an exaggeration or a pretty closing phrase for the end of a video. It is literal reality confirmed by thousands of clinical cases. Write in the comments which of the 6 signs surprised you the most, because I genuinely want to know what turned out to be new for you today. We will see each other in the next episode, but for now, go to a window. Look at your hands and give your body the chance to tell you the truth.